you have a child with Prader-Willi Syndrome? Wondering, what do you have to be aware of when you've got a child with Prader-Willi Syndrome? Hi there, it's Neesha from My Favourite Physio. In today's video, I'm jumping in to share some facts about hip development for a child with Prader-Willi Syndrome. So here at My Favourite Physio, we see lots of little ones with rare genetic conditions. One of those conditions is Prader-Willi Syndrome. And often when families have been told that your child has a condition, then they're often stressed and overwhelmed, understandably. But they are also thinking, what must I be aware of? What do I have to do to help my child achieve their best potential? And this is where we, as expert pediatric physiotherapists, think about your child holistically, and we're always proactively trying to prevent secondary problems and promoting the best outcomes for your child with special needs. When it comes to children with Prader-Willi Syndrome, they are at a higher risk of having developmental dysplasia of the hips. That means that babies with Prader-Willi Syndrome are more likely to have hip problems. Their hips are more likely to be well developed at birth, and it is really important to keep an eye on their hips as they grow up. Studies have shown that in the general population of newborn babies, the incidence for developmental dysplasia of the hip is perhaps only 1%. In a study, it was shown that their population of children with Prader-Willi Syndrome had a 30% incidence of developmental dysplasia of the hips. Part of this is because the babies have low muscle tone. Part of this is that they are not walking early. Part of this is that they're so flexible in the womb that their legs are often everywhere and their hips are not well developed. So the studies followed these babies and children and came to the conclusion that babies with Prader-Willi Syndrome require hip ultrasounds to scan and monitor their hips over time. Once they're over 6 months old, they'll need hip x-rays at regular intervals to check on their hips, because children with Prader-Willi Syndrome have low muscle tone and they're more likely to have hip migration over time, meaning that their hip joints can actually start to come out of their joints over time, partly because of their delayed development and partly because of their low muscle tone. So the studies have actually recommended that if you have a baby with Prader-Willi Syndrome, they need their hips scanned at 6 weeks old, at 1 year old, at 2 years old, at 5 years old, at 10 years old, and 15 years old. The aim of having a scan early is so that we can monitor and treat as soon as possible. Babies who are picked up with hip dysplasia at 6 weeks old can have a harness, and we generally are able to improve their hip development and prevent secondary problems down the road. So if you have a baby with Prader-Willi Syndrome, it's really important to talk to your pediatrician about having hip scans. If you're concerned about your baby's hips and you would like to speak to an expert pediatric physiotherapist, you can certainly ring us here at My Favourite Physio and speak to one of our expert pediatric physiotherapists. The number to ring is 02-9790-4233. And if you know somebody out there in your role who's just been told that their child has Prader-Willi Syndrome, please like and share this video with them. Until next time, have a fabulous day. Bye.